A breast to cancer, she may have to decide to have reconstructive surgery. Well, some methods use implants consisting of man-made materials. Others use tissues taken from the woman's own body. When the tissue is transplanted from another area of the woman's body, it's vitally important that it have good blood flow. As News Channel 5's Kelly Dunn reports today, there is new technology which helps to determine which tissue has that all-important flow called profusion.
In 2006, Lynn Curry found a lump in her left breast. A mammogram showed a benign cyst, but then, unexpectedly, doctors discovered a cancerous lesion in her right breast, and testing showed that additional areas of the breast had atypical cells.
And we decided that mastectomy was probably going to be the best option.
Lynn considered having reconstruction, called a DAP flap.
DAP flap is actually a free transplant where the tissue is completely removed from the body and then transplanted to the chest. So in that case, they need to harvest an artery that they use to graft into the arteries in the chest to supply the blood.
Without good blood flow, the transplanted tissue can die.
There would be healing problems, wound healing problems. There could be tissue necrosis or death.
Luckily for Lynn, during the 6 months during which she was having chemotherapy, her doctor developed a new technique to determine whether transplanted tissue had a good flow of blood. Borrowing a method used by cardiologists, Lynn's doctor injected fluorescent dye and used a laser to see the flow of blood.
We inject the dye intraoperatively and then use the laser to image the dye, and it tells us the perfusion of the tissue with crystal clear clarity. What we're looking at here is the flap, the tissue that has been selected for a transplant. And as you notice, the glowing begins to increase. This is telling us exactly where the blood flow or where the perfusion is. And in her case, it did help us to identify the particular tissue that was best perfused. She had no fat necrosis, no wound healing complications at all. She did very well.
Kelly Dunn, WPTV News Channel 5.